Okay, Eric Alberts, thank you so much for joining us today. You are Orlando Health's Corporate Director of Emergency Preparedness, correct?
Yes.
Okay, well, thank you so much for agreeing to spend yet another hurricane season with us and helping to inform our viewers. So today I just want to start with the basics. Every year we spend a whole day, weeks honestly, leading up to hurricane season, talking about how important it is to prepare for any upcoming storms. But still, there are those people who say, I've lived in Florida my whole life, and they ignore that. So why is it important, no matter how long you've lived here, to prepare for hurricane season?
We know the honest truth of that is it only takes one. You've heard this probably many times since you've lived here, but the reality is, if you've looked at past history, there are many opportunities for just one strike from a hurricane or even a tropical storm that kind of sticks around and provides a lot of rainfall to us in a short amount of time. It could cause major catastrophic damage and issues for us. And that's just one storm, that's one hurricane, and yet we have the whole rest of the season to contend with. And I think a thing that really highlights all this is the National Weather Service, National Hurricane Center, has actually bumped up their hurricane tracking to start at May 15th. So they are already looking for hurricanes ahead of the actual start of hurricane season, which is June 1st, for a reason. And that's because the environment, nature, as you will, is changing, and it's becoming more active. And a lot of the hurricanes that have been out there have been very violent. So it really is a contingent on us to be proactive and prudent with our preparations. And we have to remember, again, it only takes one.
Right. So let's talk about some of those preparations. What do people need to get in order? We're recording this interview May 19th. So if you haven't started, you're late, right?
Yeah, it should be a continual process, right, all throughout the year, because we don't have just, one threat we have to worry about being hurricanes. We could have tornadoes, we could have a lot of things. So having an emergency kit is really paramount. And, in that kit, you want to have good supplies for not only you, but everyone that's going to be with you. So your loved ones, your family, your pets, okay, babies, whatever you have that's with you, you got to plan for. And the general census is you need to have at least 1 gallon of water per person per day. And you really should have at least 3 days of non-perishable food for each one of those individuals. And then there's a lot of other supplies that go along with that, like medical prescriptions, any kind of sanitary things, like diapers for babies, wipes, any kind of sanitization wipes, hand sanitizer. Especially with COVID-19, we've got a lot of things we've got to be prepared for and just try and make sure we keep clean with. And then even little simple things like having a dust mask and having a whistle and having flashlights with batteries and a hand cranked radio so you can get updates, So those are just a few of the many things that we want to make sure we have for a hurricane.
And I know this is now our second hurricane season with COVID-19 in the mix. Last year, we were, closer to the beginning of the pandemic. And so they were telling people to prepare. When I say they, I mean the experts. They were telling them to prepare for the possibility of having to ride out the storm at home because we didn't know if it would be safe to go to a shelter and pack all those people into a shelter because of COVID. What are your predictions now that we have vaccines in the mix? A good chunk of our population has been vaccinated. So what should people plan to do? Stay home or head to a shelter if given the opportunity?
That is a great question, and it's really conflicted. Okay, the answer to that is really conflicted. And the reason I say it's conflicted is it's contingent on the family and the family unit, and it's contingent on the environment they live in or the community they live in. So each county or jurisdiction has right now and will have different stances on COVID-19 precautionary measures. Some will have masking requirements, some will not, some will, if you've been vaccinated. So there's all these variables in place, and it's really prudent for each individual person and family to think through what they're going to do. So having that plan is really paramount. If we're going to stay at home, we need to shore up everything at home. If we intend on evacuating because we're in an evacuation zone, where are we going to go? Is it going to be at a local shelter? Is it going to be at a shelter in another area of the state? Or is it going to be a shelter in another state? And again, anytime you look to expand your scope, if you go outside your local area, you have more to contend with. You're going to have other masking mandates, social distancing, cleanliness standards. And again, there's no standard premise right now, and I suspect it's probably going to continue to be that way, as we've seen all throughout COVID-19. So you're going to have to do a lot of research, right? You have to look at a lot of websites. You may have to call like local emergency management offices just to see where they're at with their protocols. Because again, it's just going to vary so much. And as we progress later in hurricane season, it may change again, right? So the beginning, June 1st, and the protocols will probably look very different to near the end in October and November.
It definitely adds a few layers to the planning process on all ends, really. So speaking of that, how are you guys at Orlando Health preparing for the season and doing that while we're still in the pandemic?
Yeah, so the continual process of ensuring we have enough supplies for our staff, being personal protective equipment like masks, respirators, gloves, the gowns, all those types of things, as well as water. We're doing a lot of work to ensure we have enough water for our patients and our staff, batteries and flashlights and all that stuff. But we're also looking at our generators and our fuel supplies to make sure we have enough of that, not only now, but throughout all of hurricane season. And really just trying to update, emergency contact list and our plans. It's a continual process to update our plans based on what we've learned in the past. So, for us in healthcare, we have a lot of requirements, and there's a lot of things for us to continue to look at and do. And when you look separately to individual people that live in our area, they don't have those requirements, right? So it's really up to them to do a lot of this preparedness. And that's where the gaps come into play. And, really just want to highlight, please, I beg you, please don't expect to just jump in your car and drive anywhere you want, to do whatever you want when there's a hurricane or a tropical system. It's not that easy. You got to have a plan. You got to have a kit, just like we do in the hospital, for all types of disasters.
So speaking of that, if there is some sort of medical emergency, you are the people that the people in need would turn to. What advice do you have if they do happen to have an emergency, either leading up to a storm or actually during the storm, and they need medical attention?
Yes, the first thing you want to do is always look after yourself, medically speaking, right? So if you're not feeling well, follow up with your primary care physician so it doesn't become an all-out emergency for yourself. And I would say, one of the best things is to build out like a contact list of all your physicians that you go to with their name, their address, and their phone numbers, so how to reach them on a normal day, but also an emergency. And you want to carry that with you all throughout hurricane season. And that will be helpful after a strike from a hurricane or a tropical system. Now, if you do have an emergency, obviously we're here to help you. So please come on in. We'd be thrilled to help you. We hope that doesn't happen for your sake. But when it does, we're here when it matters most. And so again, it's a lot of the preparedness stuff, just writing down on a list everything that you've got, and putting that together in a waterproof container that has other files like your medical records, your license, and your insurance cards. Just having that all together in like a folder and then putting it inside a waterproof pouch, which you can get online or even one of the big stores. And you just want to carry that with you and have it with you because you just want to be prepared, right? And then when we're talking about response to a tropical system or hurricane, there's a lot of threats that are inherent with that. Water is one of the biggest threats, and we often see a lot of flooding. We often see a lot of drowning and a lot of deaths because of high water levels. And just a simple reminder that 6 inches of water can actually cause a car to lose traction. Just 6 inches of water, and then 1 foot, most cars can actually float away. And when you look at our afternoon thunderstorms, sometimes we could reach those thresholds, and yet people just drive right through those big bodies of water on the road and all that. So, that's one big hazard. Just remember, with water and water on the roads and vehicles, they don't mix too well. So you really have to be careful. Another one is ladders. A lot of people will use ladders to look at damage immediately following a hurricane, and it's still wet out. There's a lot of branches down, they're not on even ground. So unfortunately, there's a lot of falls from ladders, and there's a lot of back injuries and hip injuries from falls from ladders. And another one is chainsaw injuries. So, a lot of people are not trained to use chainsaws. They go and buy one thinking they can do a lot of great things after a hurricane. And you'll find them swinging the chainsaw back and forth, at branches that are way off on the ladder again. Those are really bad, dangerous things. You cause major amputations and major injuries or cuts to yourself, and you end up in the trauma center or another hospital. So, you got to be really careful with how you respond after a hurricane. And one of the other big things is carbon monoxide poisoning. That a lot of people end up using a generator or even some kind of a lantern or a grill inside their home or inside their garage. But they don't realize that, that causes carbon monoxide, and the carbon monoxide is highly poisonous to the human body. Generally, there's about 500 deaths every year from carbon monoxide poisoning. And, it's sad to see after a hurricane, you'll find news media's updates, even on your channel, of carbon monoxide poisoning and deaths because people inappropriately used generators and grills and those types of things. So please be really cautious with them. Go outside with them. Don't use them inside your house. So there's many other things that can happen, but those are some of the big things. You find a lot of tree limbs that are down. They're really sharp. They're big. They're heavy. And a lot of people think they can move them, even off roads. And sometimes you need help. So don't expect to do everything yourself.
So yeah, what is your advice for, thinking twice before picking up the chainsaw? Is it that people are in such a hurry to get back? Like once the storm is over, they think it's over. But if you were lucky enough to make it through the storm, sometimes the worst part of it is after. Do you need to wait for the professionals to get to that stuff, or just make sure you're well trained on, climbing that ladder or using the chainsaw? What's your advice?
Yeah, good question. So you want to pay attention to what the officials are telling you. When it's safe to go outside, the emergency management offices, the National Weather Service, local media will tell you when it's safe to go outside. And when that occurs, you got to be really careful. There's going to be a lot of hazards. They may be down power lines. There may be gas leaks, down trees, damage to your roof. And the biggest thing to know with all that, if you're just, a general person out there that doesn't have a lot of training, is use your common sense, right? Know your level of training and your experience. And if you don't feel good about something, if it doesn't feel right, if the hair stands up on the back of your neck, it means, uh-oh, I'm in danger. I need to stop what I'm doing. I need to back up. And I need to either wait for a professional or I need to wait for someone to come help me. And there's no harm in doing that, all right? It's not going to hurt anybody for waiting another hour or two to do that, okay? So just take an abundance of caution, take your time. This was a really bad thing that happened, this hurricane or storm, and it takes time to recover from that. It doesn't happen in a half an hour. So just know that, don't rush. Don't put yourself in harm's way. And if you don't feel comfortable or safe, it means you're probably not comfortable or in a good situation.
Yeah, a storm is dangerous enough. You don't want to go out there and create any additional hazards. I do have a question. Let's go back to talking about before the storm. What should someone do or incorporate into their plan if they're planning for their family, if there is someone with special needs or someone who needs special medical attention in their family?
Yeah, that's a great question. So you want to make sure that you have the documents, go back to the records. You want to have any kind of documentation on doctor visits or hospital visits, because that will help with the treatment of the patient if they have to go to a doctor throughout this situation or even after it. You want to make sure that you've got insurance cards. You want to make sure you've got some cash on hand in case you got some medical bills that you've got to pay for. But the biggest thing with special needs individuals is to make sure that there's an advocate with them all the time. Somebody that's able to communicate instructions, any kind of special needs that there are for the individual, any kind of allergies, anything they're really allergic to that could put them in a bad situation with having to go in the hospital or to go in a shock or something like that. So, having the documents and having a really good spokesman throughout the response and the recovery piece of a hurricane is really important. If you go it alone, you're really putting yourself at extreme risk. And when in doubt, get a hold of the local emergency management offices in the state of Florida and just look for a special needs shelter. Try and get on the special needs registry so you're not really stuck and you're not questioning and you put yourself at risk and then others put themselves at risk trying to help you after a storm. So I think it all goes back to preparedness, right? Please take the time now, be honest with yourself. If you're going to need help, look for that help now. Don't wait until it's too late. And, put yourself on the registry if you feel like you meet the requirements. And just ask for help. Have somebody that's your advocate. Don't wait until it actually hits or strikes. It's too late then.
If I remember correctly, in years past, you would come in with a big tub. That was your hurricane kit full of items, right?
Sure. Yeah.
I wish that people could see that. I'll see if I can dig that up for people. But you did go over some of those items. And of course, we have a checklist of must-have items on clickorlando.com. But if you start early, you do have that luxury of putting a few more items in than just the must-have. So is there any, let's get to the pro tip level. If you've started early enough, what are some things in your kit that aren't a necessity, but do make riding out a storm easier?
So there are many things that should be required, and there are many things that are niceties, as we call it, or nice to have in your kits. And those are things like creature comforts, right? So what are your favorite snacks? What are your favorite treats you like to treat yourself with? You're going through a stressful situation in a hurricane. You don't know about your friends, your family, or your home. And you don't need to be stuck in a shelter or in a hotel or even in your house without anything to do or eat. So sometimes little things like that will help calm you down, as odd as it is, but it's true. Having board games, cards, coloring books, anything you can do that you like that is not required of power or energy. So it's really good to think about those things ahead of time and what you like. Maybe it's to draw or paint. Those are all great things. A lot of people's exercise. So having a mat and some exercise equipment ready to go. So those are some extra pro tips that everyone should really think about as you'd be bored out of your mind just sitting there waiting. And if you look back to Hurricane Dorian, a couple years ago, that thing spun and spun and spun for like 7 or 9 days, and it drove everybody crazy. Yeah. And if you're in lockdown for an extended period, what are you going to do? So having those creature comforts and things to keep you preoccupied are going to be really important. And then, if you've got time on your side and you take this serious, you can build out your plan of your kit and your plan appropriately. Mm-hmm. A lot of people rush. They'll go and grab a couple gallons of water, a couple gallons of milk, which I don't know why, because it spoils if you don't have power. Toilet paper, right? Everyone's still doing that thing. I don't know why, but they are. And food, so non-perishable stuff. But just remember, you can build up to it ahead of time. Look for the buy one, get ones that are out there. A lot of the supermarkets and big stores have them. Just remember there's expiration dates even on water. So get it, look at your kit once in a while, make sure the items are still good, but build up to it. And I think that's what's important for everyone to remember. There's been a lot of concerns or issues with employment or unemployment and cut downs in certain workforces because of COVID-19. We've seen that all over the United States. And it's just really important for everyone to know you don't have to go out and spend hundreds of dollars all at one time. I mean, if you had the money, that'd be great, but most people don't. Mm-hmm. So build up to it where you can. When you're at the store, if it's on the list, it's buy one, get one, you can afford to get one, you got another one free anyway. So just go ahead and do it. So I think just thinking ahead and planning ahead is what's really important.
That is great advice. And I hope we all learned from the toilet paper scare last year that you don't want to wait till everyone needs that item that you're looking for, because it won't be there, whether it's
Yeah,
water or canned food or toilet paper. No matter what it is, if everyone needs it, it's not going to be there when you get to the store.
yeah, and just put yourself in that picture, right? I don't ever want to be in that situation again. I remember going to the grocery store and just scratching my head like this, like, really? Is this for real? I mean, why? But it happened.
I think we should do a follow-up story to that. What did everyone do with all that toilet paper that they hoarded? Because there was never an issue. I think that's interesting. Well, is there anything else that I didn't ask you that you want to touch on about either preparing for the storm, what to do during it, or maybe after?
Yeah, just, I can't speak to this enough. Please don't wait until the last minute, because it really will be too late. It's, if you're finding yourself rushing around because the storm or the hurricane's upon us, it's too late. You'll have short amount of minutes or hours to do what you need to do, but I'm sure the supplies are already gone. So take the opportunities now to build your plan, build what you can in your kit. And just remember that COVID-19 is not going to go away really quickly. I know that a lot of people want to get back to normal. CDC and a lot of others are starting to ease a lot of the restrictions, but there's still a lot of requirements out there amongst a lot of communities. So every county, every city is different, and you have to be mindful of that. They're not all going to be the same, and not everybody's vaccinated either, right? So that's a big reminder to either get vaccinated or to just think about that, because smaller children haven't been vaccinated. There's still a large amount of our population that haven't been vaccinated yet. So we have to think about that stuff when we're also responding to a hurricane.
Well, I know that at Orlando Health, you guys are very much like news. If we were to have a hurricane, you guys don't get to spend it at home with your families. That is when the community is relying on you. Work is still happening. So, and throughout the pandemic, you guys have just been busy nonstop. So I thank you for what you do. And I thank you for making time in your busy schedule to take time to inform our viewers. We always appreciate your expertise.
Well, thank you so much. We appreciate this and the opportunity to speak with you today. And just remember to plan ahead, and that hospitals and other healthcare are not shelters. We're only here for you during emergencies or disasters, and we just need to continue to remain operational. So now's the time to plan and think, and get together with your family and build your kid your plan. And we hope for better things. That it's not a bad active season, but it only takes one. So thank you again for your time, and appreciate you and taking this serious and talking to us today.